A group of highly skilled emergency doctors and nurses are launching a breakthrough treatment which will allow them to administer blood transfusions at the roadside. The Medic One team, who are based at the Edinburgh Royal Infirmary, attend serious calls to patients who need immediate intensive care. Through the new innovation, patients will no longer have to wait to arrive at hospital to receive the life-saving treatment they need. Susan Ripple reports.
For doctors and nurses sent to the scene of a devastating car crash, time is of the essence. In many severe cases, the journey to get to hospital can often mean the difference between life and death. Now, thanks to a new system, they'll be able to give patients blood at the roadside.
For a proportion of those patients, they cannot wait to be taken to hospital, particularly those patients that have major bleeding. So for us to be able to give them blood on the side of the road buys them the time they need to get to hospital, and particularly getting them to an operating theatre.
The team treats around 80 patients a year who have suffered major illness or injury. 1 in 10 of these are severe, and being able to perform a blood transfusion out at the scene will make a huge difference towards saving lives.
Inside it, there's a specially designed box.
The blood is stored in a fridge within the hospital. It contains 2 units of O-negative type, which can be transfused into any patient. When called to an emergency, the team can transport the blood to the scene, where it's warmed up using a special device. It's only after developing all of these elements together that the team have now been able to administer this breakthrough treatment.
Before, this has been very difficult because of the strict regulations that are involved in blood transfusion, but through our very close collaboration with the blood transfusion service, we've been able to put in place the systems that are required in order to be able to deliver blood at the roadside.
It's this ability to bring hospital-level critical care directly to major trauma patients that will give the best possible chance of survival. Susan Ripple, STV News, Edinburgh.